Yonah Mountain Vineyards, which is a beautiful vineyard and winery in North Georgia that I've been fortunate enough to work with over the last few years, working the tasting room and doing tours for people that come up and who haven't seen the North Georgia mountains. It's a really special place for Lauren and I, and every time I go there, it's nostalgic. It's almost therapeutic when we go there.
So we got married up there on the hill, and I remember my favorite part was in the vows. I was talking about how you described how like our love is like a fine wine, how it just like ages over time and just gets better and better. We still talk about it all the time. Like, it was the best day ever. We had been planning our wedding for 2 years.
We're planning for like one of the best days of your life, and then
A month before the wedding,
this happens. I'm Josiah, and I've been diagnosed with a rare form of brain cancer, glioblastoma. I started having, I call them episodes because I didn't know what else to call them.
it was probably in May, the year we got married, and I was on my way to pick up food for both of us, and I got a call from him, and I was just on my way back. It hadn't been long, so I was a little concerned, and he sounded really scared and said that he was having really intense deja vu, and a metallic taste in his mouth and a smell of weird spices, and that he was scared.
I would just zone out, and then I'd come back after a minute or so, and I didn't lose consciousness. I wasn't having violent reactions at all. I would just doze out, lose my concentration, and then it would go away like a minute later.
He said that his head was hurting really bad, so he was having a migraine. So I scheduled him an appointment with a local neurologist, and they scheduled an MRI, and that's how we found out the tumor in his brain, and that it was about the size of a man's fist.
In general, glioblastoma is a very rare tumor, and we shouldn't have it at the top of our list of possibilities when somebody has new problems, neurologically or otherwise. The types of things that could get us concerned about glioblastoma as a potential explanation are things that are associated with increased intracranial pressure, so headaches, nausea, and vomiting, as well as new neurological deficits, so weakness, numbness, language problems, etc. So what cancer is a collection of cells that are inappropriately dividing. And in the context of glioblastoma, that's one of the problems, that we have this uncontrolled proliferation, so more cells making more cells when they shouldn't be. The other big problem that we have is infiltration, so these cells becoming interwoven with normal healthy brain. And this is a differentiating factor when we're thinking about glioblastoma compared to other cancers.
On October 16th of 2019, I had the surgery to take out the tumor.
It was really scary, but Josiah and I felt throughout the scariness of it that we still just had a sense of peace, which was kind of concerning because, you know, how are you supposed to have peace with a brain surgery coming up? But we really did. We really felt like God had given us a sense of peace that we couldn't even explain.
Glioblastoma is the type of disease we do not view is curable at this point in time, unfortunately. And so when I'm thinking about the management of patients with glioblastoma, I'm thinking about maintaining a reasonable quality of life while we're going through the treatment process. So the typical treatment regimen for glioblastoma is extensive surgical resection, so having the surgeon try to cut out as much tumor as possible without leaving the patient with any new deficits, followed by radiation therapy that's delivered in a focal, fractionated manner, meaning on that area of interest, broken up into little doses every single day, reaching a large cumulative dose. We usually give concurrent temozolomide chemotherapy, which is a chemotherapy pill that is an alkylator. It injures the DNA of these tumor cells, leading to their death. and this is usually followed by additional cycles of the temozolomide chemotherapy with the addition of something called tumor treating fields, which are electrical fields delivered via a set of arrays applied directly to the scalp.
It affected a lot of things. We had planned a long honeymoon. We were going to be gone for 3, almost 4 weeks. We had to cancel all of it. The honeymoon was really short, and the entire time we were both thinking about, what was coming next.
The neurosurgeon had mentioned that he may lose some memory and some skills, so we were fully prepared to have to, reteach him and have him, remember those memories that we had had throughout our relationship. So it was a 6.5-hour surgery, and I was begging them at the hospital to let me go see him. I just wanted to see him after the surgery. And I looked behind the curtain, and he opened his eyes and said, "Hey, baby doll." And I just smiled so big because I was so worried he wasn't going to remember who I was. And that's what he calls me. So to hear him say, "Hey, baby doll," right after a 6.5-hour brain surgery was pretty amazing. The fact that he remembered our wedding and our relationship just made me so happy. I can't put it into words how happy it makes me.
After radiation ended, I was still on chemotherapy, and my doctor put me on TTF field treatment, and that helps separate the cancer cells from forming into an additional tumor. The type of cancer that I have is aggressively reoccurring, so a clean scan doesn't necessarily mean that it's gone and it's not like most where you can go into remission. So I'll have another MRI in another 3 months, and I'll stay on treatment, and I'll be on a cycle of chemotherapy until February of next year, and then they'll reevaluate. It's affected social life and my job, even my marriage a lot. I mean, the kind of stress it puts on Lauren and on myself, and being on radiation and chemotherapy alone, it changes the way that you feel. It changes your eating schedule. It makes you a really nasty person to be around at times. Yeah, it in all truth, having GBM is awful, but I think we've found a very healthy median of embracing the facts of the matter, of the life that we have now, and also challenging the status quo of how people necessarily intend to or typically deal with a struggle like this, and turning it on its head and trying to make sure that every day matters.
My coworkers suggested doing affirmations with each other, which I never really heard of doing.
Lauren was really sweet and suggested that we do them together because she felt like she needed it too.
We will hold each other's hands and stare in each other's eyes and say, "We are healthy.
We're healthy.
We are healed.
We're healed.
And God's continuing to heal us."
And God's continuing to heal us.
She says, "God's continuing to heal you," and I say it back to her. And she says, "He's continuing to look out for us and keep us safe," and I say it back to her. And it helps us both out. It helps us stay strong and stay focused. Crazy thing is, I've never been a crier before in my life, but ever since this happened, I just can't control myself.
When we found out the diagnosis, he didn't say it in those words, but almost was like, "Are you sure you want to be with me?" And it wasn't a choice to me. It wasn't something I had to think about, if I wanted to deal with this with him. It was exactly what I wanted to do because I love him.
Caregivers play a tremendous role in the treatment and management of patients with glioblastoma. They're the ones who are on the front line, and so they're the individuals whose families are able to marshal the resources to get them to the clinic, to get them to radiation, to be there when they're having the surgery, etc. And so the greater amount of support that an individual can have, probably the better it is for them with regards to outcome.
When you're going through it, you feel guilty at just how much it costs everybody else around you to put up with you. And you kind of have to push the barrier with and just realize that your friends, your family, they're there to love you. They're there to take care of you. And they don't mind as much as you think they mind.
One of the difficulties with treating glioblastoma is the inherent treatment resistance that these tumors develop. We haven't yet fully understood that within the context of glioblastoma. So at this point in time, there are a number of different avenues of investigation for possible treatments for glioblastoma. Immunotherapy is one particular area of interest, and there's a wide range of immunotherapeutic approaches ranging from vaccine studies to immune checkpoint inhibitors to oncolytic viral therapies, which all hold some degree of promise. There are other approaches using novel targeted therapies, so going after specific abnormalities within the tumors that may also prove to be successful.
I think it's really important that anybody with glioblastoma understand that everyone has battles. You're not alone. This is just yours. And instead of sulking, which initially is something that we all do, and you can't let that become a way of life. You need to embrace the fact that everybody has battles and this is just yours.
You really do want to live every day like it could be your last. It really puts arguments or newlywed issues into perspective because there's something so much bigger going on. You're stronger than you think you are, and Josiah is definitely the embodiment of that. He's just such an amazing person, and he and I are just very, very blessed.